Hey, it's Robbie from One Arm Graphics. Today, just going to show what physical therapies and tools I use to help combat my chronic shoulder pain, and upper back and shoulders. First thing we're going to do is just using the foam roller. I picked one of these up from the sports shop a few months back, and it's been really good. Just using it to target the back and shoulders mainly, and it's just really simple, rolling it out and targeting that shoulder area is where I get the most benefit. And try and do it a couple of times a day on the weekends, and at least once during the weekdays when I get home. The other thing that I use to target, to really get in there and target the actual area where I get the most pain, other than a wheat bag, is this thing. It's called an acuball. Over here in Australia it was about $40, which is a little bit expensive, but it's been really effective. You heat it up briefly in the microwave for about 40 seconds, and then it's just going to give you a nice sort of a warming effect. To target the shoulder, my physio showed me this trick, basically popping it where you want the site, and then up against a wall, and then you can lean into it with as much pressure as you like. The acuball works best if you try and relax as you're doing it, which is going to be a little difficult because it's reasonably uncomfortable or painful. But I've noticed that if you relax and breathe into it, it really does feel like the pain kind of gets flushed away. It probably seems a bit silly, but I've definitely noticed if you can relax, you get a much better benefit out of it. Because I do a lot of computer work as well, I often forget to look after that side of my body, and that side actually feels much more tighter than the other. So again, I'll just do a leaning into the wall like that. When I have a lower back strain, we use the acuball just simply on the floor, and it's got I think they call it the spine aligned belt, and that's gonna target your spine really well. And you can see there those nodules are able to really target the trigger points, as they call them, and we notice I've got some pretty horrible looking indentations sometimes if I get up from the floor after a few minutes on there, but it's been absolutely magic. You'll see I've got some blue stuff on me today. That's the kinesiology tape. We've experimented with how to apply it. This is the current method. We're trying to look after the trapezius muscle, as I get a lot of strain there from subconsciously shrugging my shoulder. So that tape is applying a stretch and just helping support, and also helps me be conscious of don't shrug. Tape itself is reasonably expensive as well, but definitely has made a big difference with just the physical side of things. Other than that, if you follow me over to the chair, so with the heating pad, it's one of my favourite things to use at night. Simply getting it on the back and upper shoulders, and then lying back and relaxing. It's obviously very, very soothing, being a heating pad, and saves the constant getting up to the microwave every half hour to reheat the weeding bag, which is a pain in the arse, and the wheat bag isn't able to target as much of the back and shoulders as this can, but the current wheat bag that I've got, if you just stay there once, we've used many different types of wheat bags over the years, and this is the current one that's working the best, as it's got the stitched segments, and that allows it to really just sort of wrap around and lay well against the area that I'm usually trying to target the most, which is again just simply that shoulder. So yeah, those are the physical things I use on top of the medications. The foam roller and the acuball have been pretty recent, added to the toolkit, but the foam roller, I think, definitely feels best for sort of overall body stuff, and the acuball is the best for targeting that, and then the heat and wheat bag is best for sort of overall relaxation type of stuff.